Everyone, this is Miss Gibson. This is lecture 5 over the immune system. So the first thing we're going to talk about is, forgive me, my frame is always off. The first thing is acute rhinitis. This is just the common cold, the most communicable disease. It is usually viral. It can be direct or indirect transmission. The virus enters via your respiratory tract and begins to replicate itself. Once in the bloodstream, symptoms begin to show and spread. Acute rhinitis, signs and symptoms appear about 24 to 48 hours after exposure. You're going to have cough, sore throat, runny nose, congestion, sneezing, headache, fatigue, and malaise. No antibiotics needed because it is considered viral. So you're just going to treat the symptoms. Common cold is an infectious viral disease caused by rhinovirus that affects the nose and throat. Adults usually get it 2 to 4 times per year. Touch spreads 80% of colds. Seasons for colds is fall, winter, or if it's a rainy season. Rhinovirus causes about 10 to 40% of colds. 1 in 5 working adults experience at least one cold every year. Children suffer from an average of 6 to 8 colds per year. Yearly, Americans spend around $5 billion on cold medicines. Each year in the United States, 62 million people are affected with a cold. Influenza. This is acute febrile viral infection. It impacts the respiratory tract. It can be fatal for your immunosuppressed patients. Transmission is through contact with respiratory secretions. Droplet or airborne precautions is usually what is used in the hospital settings. There's 3 types. Types A and B cause seasonal epidemics. Type C causes mild symptoms. Symptoms of the flu can be runny nose, sore throat, body aches, fever, chill, stuffy nose, cough, fatigue, and headache. Is it a cold or the flu? Signs and symptoms. Symptom onset is usually gradual for the cold, abrupt for the flu. Fever is rare for a cold, but usual with the flu. Aches is slight for the cold. Usually you're going to have body aches and chills with the flu. Fatigue and weakness, sometimes with the cold, but usually you will have the fatigue and weakness with the flu. Sneezing is common with the cold. Sometimes you can have that with the flu. Cough, you can have with both. Stuffy nose, sore throat, and headache with both. It says rare for colds, but I know anytime I've ever had a cold, I've ended up with a headache. Complications would be bacterial pneumonia, ear infections, sinus infections, dehydration, and then worsening of chronic medical conditions. Diagnostic test is swabbing the nose. Sometimes they can do a sputum and throat culture as well, but generally it is you get your nose swabbed for the flu test. Treatment is supportive, antibiotics for secondary infection, hospitalization for elderly and high-risk groups. There's also Tamiflu that can be given. It must be taken within 2 days of start of symptoms. for children and adults, usually taken for 5 days. It can be taken after exposure. Stop the flu. It's up to you. You want to get the flu shot. It's highly recommended. Wash your hands. Stay home if you're sick. Ask your healthcare provider about a prescription antiviral, which would be that Tamiflu. Now we're going to talk about chickenpox. The characteristic feature of varicella or chickenpox is that the rash, blisters, and bumps all form at the same time. Varicella or chickenpox is you must come into direct contact with respiratory secretions or secretions from this rash. With chickenpox, you're going to have a loss of appetite, abdominal pain, sore throat, fatigue and malaise, rash, headache, chills, and fever. Medical management would be vaccinations between 12 and 15 months, and again between 4 and 6 years of age. Varicella zoster immune globulin within 3 days of exposure. And then you could also be given a cyclovir to help with the symptoms. Here's a picture of a sweet baby with chickenpox. He just looks miserable. Nursing interventions: make sure nails are short and smooth. Because the rash is very itchy. Daily baths. Avoid regular bath soap. Wear lightweight, loose fitting clothing. Use mittens on young children. Apply pressure rather than scratch. Encourage good hygiene. Encourage fluid intake. And the reason that you don't want to continue to scratch is it can cause scarring. And then this is just a picture, well, try to show you, of chickenpox on someone's back. Next is rabies. This is a severe preventable viral infection of the central nervous system. Transmission to humans through saliva or of infected animal. Incubation period is 2 weeks up to 3 months or longer. It causes brain inflammation. The virus is, of course, transmitted by infected saliva through the bite or wound, or through another wound. So, clinical manifestations of rabies: you're going to have headache, nausea, fever, malaise, anorexia, where they lose their appetite, tingling, twitching sensation around the bite. As the rabies progresses, they'll become irritable, excessive movements or agitation, confusion, hallucination, aggressiveness, abnormal thoughts, increased saliva, and then paralysis. Rabies virus may infect the central nervous system. Advanced stage of the disease, they'll have double vision, difficulty moving facial muscles, abnormal movements of the diaphragm, difficulty swallowing, increased salivation, where they'll foam at the mouth, acute encephalitis. It's almost always fatal once symptoms appear. 99% of human cases resulted from dog bites, one death every 15 minutes worldwide. 4 out of 10 deaths are in children. Vaccinate to save lives. You want to vaccinate your animals. No bite, no rabies. So make sure your fur babies have all been vaccinated. If you are bit by an animal, and you're unsure if they're a rabbit or not, you will go to the hospital and they will give you the rabies injection into the wound. It can be very painful. The animals will require brain tissue examination after death. Humans, history of exposure, development of signs and symptoms. They could also have the rabies antibodies in the blood, and saliva testing or skin biopsy. Any person bitten by a bat or wild animal should be considered exposed and requires treatment. The wound should be cleansed immediately with soap and water. 3 doses of rabies vaccines will be given on day 1, 7, 21, or 28. Rabies vaccine ASAP, then day 3, 7, 14. Treatment is based on the prevalence in the area, the species of the biting animal, and severity of the wound. Next, we have Lyme disease. With Lyme disease, this is transmission from infected animals to humans through the bites of ticks or mother to fetus. Deer tick is a common carrier in Kentucky. Clinical manifestations is circular rash, which occurs at the site. Bullseye appearance, fatigue, chills, fever, headache, muscle joint aches, and swollen lymph nodes. And then this is a picture of what the Lyme's disease would look like. The bite would be right in here. Complications would be arthritis, chronic neurological problems, numbness and tingling in the hands and feet, difficulty concentrating, and short-term memory loss. There is a blood test that can be done to test for this, Western blot test and the assay test. Both must be done and yield positive results for a diagnosis. So that was a very short overview of communicable diseases across the adult lifespan. If you have any questions, please don't hesitate to send me an email. Have a great day.